Welcome to Preserve Your Teeth Dentistry, where we do exactly that, preserve your teeth. I'm going to go over a few things with you today that'll help save you your teeth and also money and time in trying to get the right treatment to protect and preserve the nerve of your tooth. Now, anytime that nerve is damaged or tampered with, you're running the risk of shortening the lifespan of that nerve and of the tooth. And what that could mean later on is eventually it won't be in your mouth anymore. That tooth will have to be extracted and taken out. And we focus on preserving that nerve so that the tooth can have a longer life cycle. Now, oftentimes when you have a deep filling, there's only one option. You're told that you need to have a root canal done. And there are alternative options for you that are a fraction of the cost and prolong the life of your tooth. It takes a lot of skill and technique, and it takes a lot of time, but done correctly, pulp capping has a 90% success rate over the course of 5 years, whereas a root canal, in comparison, could last you 2 years maybe. The tooth would then need to be extracted, you would have to get an implant or a bridge, but a root canal might not always work. There's a multitude of things that could happen and go wrong with a root canal, therefore shortening the life of that tooth. So we want to have you keep it in your mouth for as long as possible. This first case involves a patient who came into our office with a very deep metal filling. The doctor removed the metal that was there. After removing the decay, you can see how close and how deep that filling really was, which means it was getting closer to the nerve. Most doctors would recommend that you go in for a root canal, which then kind of cuts the life of the tooth. That's it for the tooth. But in our office, what we did was a pulp capping procedure. It took a little extra time. It saved the patient about twice as much as they would have spent getting a root canal and then a crown. And they were able to have a sealed and protected tooth. The final result was a beautiful onlay done by Dr. Urbankova. Now that patient walked out with a tooth that they get to keep in their mouth healthy and happy for much, much longer than they would have had if they had had a root canal done.